Okay, so for the purpose of this video, I'll be demonstrating how to properly don and doff PPE, and then I'll kind of go into the different safety precautions in terms of contact, droplet, and airborne disease. So to begin, I'll go ahead and demonstrate how to properly put on PPE. So at this point, I would have already washed my hands, and my hands would be clean. So I'm going to go ahead and put the gown on. My arms going like this. And tie it in the back. Just put it over here. Once this part is tied on, I move to the neck. Tie the neck on. All right. All right. Now that that's on, I'll go ahead and put my mask on. Mask goes on. Make sure it's tight on the nose as well as under the chin. From there, I can go ahead and put my gloves on. So I'm going to put my gloves on. I want to make sure that they go up and over the gown to prevent any contaminants from entering and touching skin. Second one goes on. All right. Now that that's on, that's putting it on. So then taking it off, I'm going to grab here on the glove and pull down until it comes all the way off. And that hand's clean. So then I'm going to take this finger, go into here, pull that glove off, and then throw that in the trash. And then from there, I can take my gown off, get off at the neck. Once the gown is off, then I can take the mask off, and then I would have hand sanitizer, or I would immediately wash my hands following taking it off. So in terms of the difference in precautions for contact, droplet, and airborne, with contact, we want to use gloves as well as the gown. However, the mask is not required. And then we also want to keep the area that's impacted or infected covered to prevent any skin-to-skin contact. And then for droplet transmission, we're going to use the mask as well as gloves and the gown. And then when we're in contact with the patient, we want them to be wearing a mask. And then 3 feet distance, if we're within 3 feet of distance, we want them wearing the mask. And then if they have to exit that room for anything, whether it be therapy services outside of their room, then we want them wearing the mask. And then for airborne, a gown would not be required. And the gloves would not be required. However, a mask would be required. And then we want to make sure that the client is in a low pressure room where the pressure in the room is lower than the pressure outside of the room to prevent any contaminants from exiting the room whenever the door is open and closed. And then let's see here. Okay, so one example of how contact transmission occurs in a healthcare setting. So this could be anything from pink eye to MRSA, which is staph infection. And so in the case of staph infection, sometimes the client doesn't know that they have the infection. So if an OT is doing services and touches an area that is infected, then transmission may occur when the therapist touches it, becomes infected, and then passes it on to the next person. And then for droplet transmission, this would be anything from influenza to COVID-19. And so if a client coughs and droplets spread, land on tables as well as on skin of someone that they come into contact with, then disease transmission would occur when the client would, say, put their hand to their mouth or nose. And then let's see here, an example of Airborne would be something like tuberculosis or measles, and disease prevention occurs when a patient coughs and the particles are airborne. Specifically with tuberculosis, particles can travel long distances. So in a healthcare setting, if, let's say, in a skilled nursing facility, a client has TB and coughs, the disease is easily transmitted if the client isn't wearing a mask, and then it can spread across the entire facility. And then lastly, let's see, give one example of how we can prevent transmission from occurring beyond just washing hands. This would be cough etiquette. So cough etiquette would include coughing into a tissue, sneezing into a tissue, and then immediately disposing of that tissue, as well as coughing into an elbow or into like a shoulder to prevent the cough or sneeze from spreading. And then lastly, obviously social distancing. So if you're within 3 feet to 6 feet, specifically for COVID, then we want to make sure that we're social distance to prevent further spread of any disease. Make sure I covered everything. Right, I think that covered everything. Thank you.